Hello, this is Dr. Kim Jong-dul. Today, we will look at the occlusal plane control. Since the occlusal plane control is a lot of work, I will divide the lecture into several parts. We want to treat orthodontic treatment without adjusting the occlusal plane whenever possible. In some cases, the value for the occlusal plane may be smaller. Moving in this way is called counterclockwise rotation. And moving in the opposite direction is called clockwise rotation. For the case that needs to be changed, we have to think about how to change it. If the maxillary posterior teeth are extruded, how will the occlusal plane change? Perhaps the occlusal plane will become smaller. This is called flat occlusal plane. And when the maxillary posterior teeth are extruded, the occlusal plane is said to rotate counterclockwise. How does the occlusal plane change when the mandibular posterior teeth are extruded? The change from red dot to blue increases the occlusal plane angle. This is called steep occlusal plane, and it is said to rotate clockwise. The occlusal plane has already been taught in the upper occlusal plane and posterior occlusal plane. Whether you're going to keep this, make a change. If you make a change, it will flatten or steepen. If it is a normal occlusal plane, it is advisable to keep it if possible. But if it is a steep POP, what if you keep it as it is? If you try to keep the steep POP, even though in class 1 molar relationship, due to the over-eruption of the maxillary anterior teeth, it will become a gummy smile or a linguversion, which will make it look unaesthetic. This patient has a UOP of 10 degrees and a POP of 12 degrees, normal UOP and normal POP. It is better to keep it if possible. On the other hand, this patient has a normal UOP and a steep POP with a UOP of 11 degrees and a POP of 18 degrees. It is desirable to change steep UOP and steep POP into flat ones. Then, how does the change of the occlusal plane appear? Rotating clockwise is called clockwise rotation CW, also known as steepening. Rotating counterclockwise is called counterclockwise rotation CCW, and we use the term flattening. The flattening of the occlusal plane occurs when using a class 3 elastics. The angle of the occlusal plane to be flattened becomes smaller. Due to this, the mandibular position is located more anteriorly. The A and B value also decreases, and class 3 malocclusion worsens. However, in the class 1 and 2, it changes in a good direction. What is the angle of the anterior teeth? The maxillary incisors show slightly labioversion, and the mandibular incisors can be linguversion. When the jaw is rotated in clockwise rotation, the occlusal plane is steepening. This is mainly caused by using class 2 elastics, and the occlusal plane angle increases. The mandibular position rotates further backward, resulting in a larger A and B value. In other words, it is a bad direction for class 1 and 2 treatment. In class 2 treatment, it is good that the mandible comes out forward, but it is not desirable to move backward. However, it is a good direction for class 3 malocclusion. At this time, the maxillary incisors have a linguversion and the mandibular incisors are labioversion. Braun said that the inclination of the occlusal plane is closely related to the dental occlusion. In general, it was said that every time the occlusal plane changes by 1 degree, the occlusal relationship can change by 0.5 mm. What does this mean? The occlusal relationship is 3 mm, and in the case of Hauff class 2, it can be solved by pushing the tooth back, or by changing the occlusal plane in this way. A desirable occlusal relationship can be obtained. That is, at 3 mm, the occlusal plane of 6 degrees can be changed. In order to adjust the occlusal plane, you must first consider the following points. These include the change pattern of the occlusal plane, the response of the occlusal plane by various orthodontic appliances, and which device to use and which tooth movement to adjust the occlusal plane. When evaluating the occlusal plane change, you must first know the normal growth pattern. Normal growth and development is that the occlusal plane rotates counterclockwise as the maxillary posterior teeth become overruption, and the mandible is positioned forward. Although it may vary from person to person, the FH to occlusal plane is flattened, and the mandibular plane is flattened, causing the mandible to be positioned forward. Second, the occlusal plane can be changed through orthodontic treatment. In the case of large overjet, it is called long class 2 elastics, to attach the rubber band from the anterior part of the maxilla to the posterior part of the mandible. What will happen to the mandibular molars when using these long class 2 elastics? The mandibular posterior teeth are extruded and moved to the mesial side. On the other hand, the maxillary anterior teeth become extruded and move posteriorly. If you use such long class 2 elastics, UOP will be steepened and POP will also be steepened. The characteristic of class 2 malocclusion is the steep POP. Therefore, it is not recommended to induce a steep occlusal plane in class 2 malocclusion. Long class 3 elastics are the elastics from the anterior part of the mandible to the posterior part of the maxilla. How about tooth movement at this time? Maxillary first molar is extruded and moves forward. The anterior teeth of the mandible will be extruded and moved posteriorly. When the maxillary posterior teeth are extruded, UOP is flattened and POP is also flattened. This is not good for class 3 treatment. Long class 3 elastics are not good in class 3 treatment because they make the maxillary first molars to be extruded, which are one of the etiologic factors in class 3 malocclusion. Next, we will evaluate orthognathic surgery. Class 3 malocclusion showed a flat occlusal plane, while Class 2 malocclusion showed a steep occlusal plane. What should be the direction of surgical treatment for Class 3 malocclusion? The mandible must be positioned posteriorly. In order to put the mandible posteriorly, the posterior part of the maxilla must be impacted upwards. This gives the mandible space to go posteriorly. This operation means that the flat occlusal plane can be turned into a normal occlusal plane. However, the occlusal plane of Class 2 malocclusion is 16 degrees. How to treat it? Mandibular advancement surgery should be performed in which the upper jaw is lowered, and the mandible is further anteriorly. Therefore, the steep occlusal plane can be changed to the normal occlusal plane through double jaw surgery. Before orthognathic surgery, these changes in the occlusal plane should be planned and executed. That is, the flat occlusal plane is made to steepen, and the steeped occlusal plane is made to flatten. Next, we will look at how the occlusal plane changes by various orthodontic appliances. First, it is necessary to organize various devices used for orthodontic treatment. These are extraoral appliance, removable appliance, fixed appliance, intermaxillary elastics, mini implant, and so on. First is headgear. Headgear is a device that is widely used to treat class 2 malocclusion. What will happen? The hypal headgear moves to distal as the maxillary posterior teeth become intrusion. At this time, UOP becomes steepen. The cervical headgear moves backward as the maxillary first molar is extruded. Extrusion of the maxillary first molar flattens the occlusal plane. Next is the use of the face mask. Face mask is a device used to move the upper jaw, which is undergrown forward. The reaction that occurs when using a face mask is that the maxillary bone moves forward, and the maxillary first molar is extruded and moved anteriorly. The maxillary first molar extrusion means that the UOP becomes flattened. Next is the anterior bite plate. Anterior bite plate is commonly used in deep bite cases. What will be the reactions when using this anterior bite plate? The mandibular incisors will be intruded, and the mandible posterior teeth will be extruded. So the occlusal plane is steepened and rotated in a clockwise rotation. One of the things we use to treat open bite is the posterior bite block. The posterior bite block covers the occlusal surface of the mandibular premolar and molars. What will be the reaction? The mandibular anterior teeth are extruded, and the mandibular posterior teeth are intruded. The occlusal plane becomes flattened and rotates counterclockwise. The next most popular device is a functional appliance. Functional appliance is used a lot to position the mandible anteriorly, especially in the case of class 2 malocclusion. The functional appliance increases the freeway space. We can adjust the occlusal plane by differential adjustment of the maxillary and mandibular teeth through the increased freeway space. Next is the transpalatal arch or TPI device. This is a device mainly used to reinforce anchorage. When using TPI, the maxillary first molars are slightly intruded. The pressure in the maxillary first molar means that the occlusal plane can be steepened and rotated clockwise. So I use TPI in growing patients with a class 3 tendency. It can be used to prevent overruption of the maxillary molar and to steepen flat UOP. At this time, the loop direction should be toward the front rather than the rear. The following is the intrusion archwire used in the deep bite case. One of the intrusion archwires is the double archwire. What will happen if you use a double archwire? The maxillary anterior teeth are intruded, and the maxillary posterior teeth are extruded. At this time, the occlusal plane becomes flat and rotates counterclockwise. I often use MEAW. With MEAW, the rotation point is between the first and second premolar in the maxilla. What will be the reaction? The maxillary incisors become intrusion and labiversion. Premolars are extruded. and molars are intruded while moving to distal. If the rubber band is not worn, UOP and POP are flattened. Class 1 elastics are used to provide this force within the same arch when closing the extraction space. This rubber band is used after extracting the first or second premolar from the mandible. This force mechanism does not change the occlusal plane. Long Class 2 elastics are sometimes used to treat Class 2 malocclusion. For long Class 2 elastics, the mandibular posterior teeth are extruded and moved forward, and the maxillary anterior teeth moved posteriorly and extruded. UOP is steepen and POP is steepen. This is not desirable for Class 2 treatment. Long Class 3 elastics are elastic bands. From the maxillary posterior part to the mandibular anterior part. This means that the maxillary posterior teeth are extruded and moved forwardly, and the mandibular anterior teeth are extruded and moved backwardly. UOP is flattened and POP is flattened. It is not recommended for Class 3 treatment. Anterior vertical elastics are the rubber bands commonly used to treat open bites. This rubber band is used between the upper and lower anterior teeth. What will happen with anterior vertical elastics? The maxillary posterior teeth become intrusion and distal movement, and the maxillary incisors become extrusion and lingoversion. The mandibular posterior teeth become intrusion and distal movement, and the mandible anterior teeth become extrusion and lingoversion. In other words, UOP is steepen and POP is flatten. The following are short Class 2 elastics. When using short Class 2 elastics, the mandibular premolar area is the part receiving force, compared to mandibular molar area in long Class 2 elastics. For long Class 2 elastics, the posterior region receives strength. For short Class 2 elastics, the maxillary anterior teeth are moved backward and extruded. The mandibular molars are intruded and mesial movement. The mandibular premolars are extruded and mesial movement, and the mandibular incisors show intrusion and labioversion. UOP is slightly steepened, and POP is flattened. This is different from the force vector of long Class 2 elastics. Let's look at the movement of teeth when using short Class 3 elastics. The maxillary anterior teeth move forward, and the maxillary premolars are extruded and forward. The mandibular total dentitions are moved posteriorly, and the mandibular anterior teeth are extruded and lingoversion. In other words, UOP is flattened and POP is flattened. Let's see the movement of the teeth when using the mini screws. Mini screws can be used to close the extraction space or to treat non-extraction cases. When using such a mini screw, it is easy to treat if it is a conducive direction to the occlusal plane control. But otherwise, the finishing may be difficult. In this lecture, we learned about the change and adjustment of the occlusal plane, according to various orthodontic appliances. In orthodontic treatment, the teeth move according to the force we applied. In other words, it would be better to keep normal POP and normal UOP if possible. In the case of steep UOP and steep POP, it is good to make changes. and it will be important to know how to empower them. These contents will be continued in the next lectures. Thank you for watching.